Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit, community-owned hospital. I'm excited to bring you programs that are going to help you identify health issues that you may be experiencing, along with the healthcare professionals that are going to explain to you where to go to get the help you need to deal with those issues. In addition, we're pleased to introduce Medical Edge, a program brought to you by Mayo Clinic, a partner of Kingman Regional Medical Center. As you all know, there are enormous challenges being faced by all of us with healthcare today. I hope these programs will bring you the information you need to become a healthier individual. My guest today is Dr. Robert Matheny, specializing in pulmonary care here at Kingman Regional Medical Center, so stick around. We'll be right back after these messages. Hi, and welcome back to Your Health Matters. I'm Jamie Taylor, and I'm pleased today to bring my guest, Dr. Robert Matheny, to talk to you about pulmonary care. Welcome to the show, Dr. Matheny.
Thank you. Pleasure to be here.
Great. Tell us a little bit more about yourself and your background. I know you specialize in pulmonary care, internal medicine here at Kingman Regional.
Right. I came to Kingman about 8 years ago. I had moved to Arizona when I was about 12 years old, and obviously went other places to do a lot of my training, and decided on completion of a pulmonary critical care fellowship to come back to Arizona, and Kingman seemed like the ideal place to set up a practice and to help to build the community.
Very good. Well, we're excited to have you here and part of the team. I know you've been a wonderful addition to our staff, and Kingman's lucky to have you.
Thanks.
Pulmonary hypertension, what does that mean exactly?
Pulmonary hypertension has been a disease which we've really identified, a lot more actively in the last, 10 to 15 years. And it's a pretty devastating disease. I'm always astounded when I get patients who have been diagnosed with pulmonary hypertension who come into my office and they have read things on the internet. They're quite often pretty depressed. It has traditionally had a pretty poor prognosis. People do poorly clinically in terms of their ability to breathe, and even the survival has not been great in the past. But I'm happy to say over the last 5 to 10 years we've come a long way in terms of identifying the disease, treating the disease, improving patients' quality of life, and it's no longer the devastating disease that it used to be. We're a lot better at treating it now. Oh,
that's good news. That's great news. I know I see a lot of people walking around town with their oxygen tanks, and so it's pretty scary and frightening, and really inhibits your quality of life, obviously, when you.
Yeah, it really can. It really can, especially if it's not identified and treated early.
Okay. We're going to watch a segment here from Mayo Clinic on their Medical Edge. It talks about drugs for pulmonary hypertension. So let's watch that video for a second.
Okay.
Viagra and Cialis are two erectile dysfunction drugs proven to work. Now researchers have reformulated those medications to treat another disease, pulmonary hypertension. The interesting twist here is that most patients with pulmonary hypertension are women.
We're going to look for shark's teeth.
A day to dig for treasures with 6-year-old Ethan. It's something Lynn Repsher thought could never happen when she heard the diagnosis 11 years ago.
You're looking at your future thinking you're going to have a family, and suddenly you're diagnosed with something that is going to change your perspective on all of that.
Lynn has pulmonary hypertension, a potentially deadly disease. For years, she dealt with treatment that involved 24-hour-a-day IV delivery of medication through a pump that she had to carry around with her. But now, thanks to drugs that were originally marketed for erectile dysfunction, she's through with all that.
One of the drugs that was reformulated for pulmonary hypertension was Viagra.
Dr. Charles Berger says another one is Cialis. You see, pulmonary hypertension is high blood pressure in your lungs. It happens when the tiny arteries that carry blood to your lungs becomes narrow. Your heart has to pump harder to push the blood through, causing pressure to rise. The increased workload can lead to heart failure. It's like a kink in a water hose. The ED drugs lower pressure in the lungs by opening up the narrowed arteries, restoring blood flow, and reducing the workload of your heart.
So if you can lower those pressures, it's analogous to taking the kink out of the water hose and allowing the flow through the water hose rather than just trying to turn up the pressure at the spigot.
And because doses of ED medications most patients like Lynn take are much lower than those used for erectile dysfunction, there are few, shall we say, unwanted side effects.
No.
In addition to the ED drugs, Lynn also takes another medication which is administered under her skin through a tiny tube. These therapies have freed her from the hassles of high-maintenance treatment and the symptoms of disease. Some of the symptoms Lynn had before included shortness of breath and fatigue. For Medical Edge, I'm Vivian Williams.
So, is that something that you use here at KRMC for treating as well?
Yeah, we do, and I sometimes get a few snickers from patients when I tell them that we're going to put them on Viagra for their lungs. But you know, Viagra was initially developed as a drug to treat traditional hypertension, and then they found out that it had these properties, you know, to enhance opening vessels, you know, obviously, you know, for erectile dysfunction, but they found out it also did it in the pulmonary arteries.
Oh.
And it got reformulated, and now it's an active part of our regimen for treating this disease. And the literature, based on the studies, shows that it really does impact disease progression in patients who have pulmonary hypertension. So it's a big part of our armamentarium in treating this disease.
And men and women.
Men and women.
Okay.
In fact, women, as you noted in that video, usually more commonly than men develop this disease. So.
Now that's interesting. Why is that? Why do you think?
You know, they don't really understand. You know, pulmonary hypertension is a disease that's related to the right side of the heart. You know, when we talk about hypertension that you measure with a blood pressure cuff, we're really talking about the left side of the heart. That's the strong part of the heart that pumps the blood out to the body.
Okay.
And but the right side of the heart, all it has to do is pump the blood into the lungs. And the lungs, you know, my analogy is like it's a rushing river that goes out into this nice, you know, smooth lake, and the lungs are this lake. It's very low pressure.
Okay.
And so the right side of the heart traditionally doesn't have a lot of muscle. It doesn't have to be strong. It just moves the blood into the lungs. Then once it gets to the left side of the heart, we have that big squeeze and we pump blood everywhere. But imagine if you take that big lake and all of a sudden you compress it down and create a big high pressure system. Then to move that blood through there, the right side of the heart has to
work harder.
Has to work harder, and it develops hypertension. And the way that manifests in patients is they get a lot more shortness of breath, especially with exertion. And for whatever reason, women seem to develop that constriction of those pulmonary vessels more so than men do.
Interesting.
Yeah, it is
interesting.
interesting.
If it's physical activity more. You know, men are sometimes more physically active to begin with.
Yeah, we're not sure, but you know, some of the things that cause pulmonary hypertension, connective tissue diseases, things like that, are also more prevalent in women than men.
Okay.
So we don't really understand that completely at this point.
Right. So what are the types of things that can cause? I know we talked briefly earlier about other things like sleep apnea. What other things can lead to?
Yeah. Well, really with pulmonary hypertension, we kind of separate it into two classes. There's what we call primary pulmonary hypertension, and that traditionally doesn't have a lot of identifiable causes, and we do have some of those. There are some hereditary things, but they're rare. But other than that, things that cause it are, as I mentioned, connective tissue diseases, things like scleroderma, which probably a lot of you haven't heard of, but they cause this vasoconstriction, this tightening of those pulmonary vessels. Also, anything that impacts the oxygen level. Our lungs are designed so that when those blood vessels see less oxygen, they squeeze down.
Okay.
It's the way we were made because it's the way that the body tries to move blood into better oxygenated areas. But when the whole lung has low oxygen levels, the whole lung squeezes down. So anything that causes low oxygen levels, so smokers are at risk for pulmonary hypertension.
Right.
Patients who have sleep apnea are at risk because their oxygen levels are dropping at night. Even COPD patients, are at increased risk. And then there's a lot of other, diseases that are associated with it. Pulmonary fibrosis is a good example. things like that. There's a lot of anatomical problems. People who have shunts in the heart, holes in the septum or in the ventricular walls can develop pulmonary hypertension. So a big part of our challenge in treating this disease is to identify the cause.
I would think so, because getting rid of it rather than just slapping a Band-Aid on it type of thing.
Right, and some of the causes of pulmonary hypertension are treatable. So it's not so much that we have to treat the pulmonary hypertension itself as if we can identify that cause and treat the cause, some patients will do better.
Sure, like sleep apnea is a pretty easy fix, truthfully. I mean, I know I'm on CPAP myself, so I know.
Right, you're right.
My husband loves it.
Yeah, if you can put a patient on CPAP that has sleep apnea, if you can get a smoker to quit smoking,
right,
especially someone who's already showing signs of COPD or showing lower oxygen levels in their blood, that's a big part of their therapy, and they will improve.
So did things like exercise, like if you're able to exercise, would...
Yeah, I would say if you have pulmonary hypertension or you're at risk for it, exercise is always a good idea, but it probably ought to be physician directed.
Sure.
We definitely don't want you to exercise to the point where you're dropping your oxygen levels at a dangerous level.
Trying to run a marathon type of thing, obviously.
Right.
You wouldn't be able to, probably.
Right, but supervised exercise is a great idea.
So what are the symptoms usually for someone that's coming close to developing?
Probably the biggest early symptom is shortness of breath with exertion.
Okay.
And you because it comes on gradually, it's sometimes very tough to identify. But if you used to be able to golf 18 holes, now you can only make it 9 holes. If you used to be able to walk up the stairs in your home without any difficulty,
puffing,
and now you get a little bit more shortness of breath, or walking down the street to get the mail, things like that. If you're just not able to do what you could do 6 months ago, and there's no real explanation for it that you can see, and you have other risk factors, you should probably be evaluated.
Okay, and you start with your primary care physician?
Yeah, I would start with your primary care physician, go over your symptoms with them carefully. Okay. You might even mention to them that you have seen this program, or you've read about pulmonary hypertension and you were wondering about it.
Okay.
Sometimes even our primary care physicians need a little prompting.
Right.
Because it's not always way up there in the things that they're thinking about either.
Okay. Well, thank you. I appreciate that information. We're going to take a break right now, look at some other messages, and then we'll come back and talk about that a little bit more, okay?
Okay, great.
Thanks. Thank you all for joining us. Stick around. We'll be back.